working with the homeless client group, there are some perceived potential risks and challenges for students. What are some key considerations for clinical educators to work with students when it comes to working with challenging behaviours?
My first consideration with students is around helping them to understand that basically this client group are not to be considered just as having risks. So I guess it's really important for them to understand that this client group have issues in their life. It may cause challenging behaviours, but don't expect challenging behaviours. It's really important that they go in expecting to meet a person first and foremost, and not to expect that the person's going to have any sort of challenging behaviour. However, you do need to skill them up to know how to handle those behaviours when they actually do appear. But it's really important to get them to see people as people first, and then to consider the behaviours. And if you can do that, then you can actually handle most of the behaviours that will come and do it in a therapeutic way and in a way that can actually build rapport.
What needs to be considered with students when carrying out a risk assessment?
It's really important that they understand the different components of the risk assessment, and for someone working in a team like ours, we not only look at things like suicide risk and risk of self-harm or risk of aggression towards others, but we also consider things like vulnerability, and we consider things like what is in the environment, because it's really important when people are going out particularly and seeing people in other places other than in a clinic setting. It's really important for people to be considering the environmental risks that are out there, and they often forget about those. So that's like, do they have a big dog? Mm-hmm. Who else is there? Do you know who else is visiting in the home? Who else might be in that general area? What kind of weapons could be there? And weapons don't have to be knives and guns. They can be cups of hot water. They can be a whole range of things. So it's getting students to think outside of the square. And then it's also around those other risks. So being aware of how to ask questions around, have you ever felt like life's not worth living? Rather than saying, are you suicidal? Other ways of asking, have you ever harmed yourself and felt better after that? Or have you ever considered doing something to yourself, and was that an attempt to actually die, or was it more just about letting the anger out and dealing with it? So getting a picture and understanding what the terms are so that you can ask it in different ways. And it's really important for students to learn how to do that and to know when to ask direct questions and when to be more broad and let people guide you into telling you about those kind of things.
Okay. What are your priorities to maintain student safety when dealing with challenging clients?
I think it's really important that you have clear boundaries and guidelines around how different procedures happen. So if that's an interview in a clinic, how that occurs. If it's an interview at a bedside, how that occurs. If it's an interview out in the community, if it's in a park, for our sakes, or at another doctor's surgery or wherever, that you talk to the student about the things that they need to consider as they're going out. And then there's the really practical things, like putting names on whiteboards and telling people where you're going, leaving contact numbers, having a word that you can say on a phone, or a procedure to follow, and making sure the student's aware of that. If something happens and they need to let you know that there's a problem, but they can't actually get on the phone and say, I have a problem. So talking the student through all of those, making sure they're really clear about those. But again, not doing it so that you have a student who's really hypervigilant and scared out of their wits, but having a student who can respond when they need to.
Yeah.
So it's really important. This is not, in giving them a message about, this is not what's going to happen, this is in case. And it rarely happens. So it's about preparing students to think through those. And I guess it's also about getting the student to think about safety. So, talking them through, if you're going into a room, where should you be in the room? If you're going into beside a bed, how close do you get? And if you're seeing someone with a walking stick, have you thought about how close you get? And often people don't think about those. You talk about personal space, you talk about not touching things that belong to others, because of those factors that can then come into play. So someone becomes really antsy that you've touched their things. So it's all of those kind of considerations, and just in your general chit chat with the student, making the student aware of those, so that they are at least thinking about that. And even if you're actually, and you know, all of my students actually go with someone else, so it's around the person preparing them and getting them to think through what could be the risks in this situation. And as you do that and get it verbalised in the student, it actually helps the student to think about that each time before they go out. So that's a really good strategy in helping students to consider and manage risk. And having a very, giving them a very clear message about, if you feel unsafe, exit. You don't have to be a hero. This is not hero worship time. This is about staying safe. So exit when you need to.
So thank you very much for joining us today, and thank you for sharing those insights. It's very helpful for the students and the clinical educators.
You're welcome.